Welcome back to Political X. Today we're going to be talking about Vietnam, a country that has had a long and extensive history, have defeated the French, the Japanese and the Americans all in the 20th century, and are now a communist-run state or one-party state. This video has been done because I want people to see what Vietnam did and how they reacted, and it's interesting because a lot of the source information has come from Oxford University and Harvard University professors based in Vietnam and their experiences in helping Vietnam deal with the coronavirus and coming up with solutions to defeat it and maintain Vietnam. Now, one of the most interesting things is Vietnam has actually had economic growth over this period. So it's going to be interesting to look at this timeline from a British perspective, or anyone else who might be watching this from around the world, and see how Vietnam approached everything. Now, you might also want to know things like, well, what about specific details to Vietnam? How's it different to other countries? Well, we have that information. So, Vietnam has a population of 97 million. Ho Chi Minh City has a population of 10 million. It is 1.4 times the size of the UK. 2.5 to 3 million Chinese tourists visit Vietnam every year. And Vietnam shares a land border with China. So there's some interesting parallels to be had. Now, there is one other big differing factor to the UK, and that's the fact that Vietnam is a one-party state and it follows communist rule, and some would consider it to be quite authoritarian. Although there is some examples of that not being the reason as to why there was such a significant difference between the Vietnamese response to COVID and the UK. Just have a listen to Guy Thwaites. He's from Oxford University and is an academic in infectious diseases and is a clinical microbiologist and was based in Ho Chi Minh City in Vietnam during the outbreak.
Of course, a number of commentaries have said that Vietnam can do it because they're a one-party state, they're a mobilization society. So, that's true, right? That's accurate.
Well, it's true that they're a one-party state, but actually, I don't. My personal opinion is that doesn't. That's rather irrelevant for this response, because actually what they did was they acted quickly and they acted in a coordinated way. They acted with very, very good communication across the population, and they placed simple, good epidemiology at the heart of their response. Now, I don't see any reason why any political system couldn't do that. The political systems that have, or healthcare systems that are more socialized, I appreciate it's probably a bit easier because you have a homogenous system, if you like, across the country, and you can press a button at the top of the country and everything else happens. But there's no reason, for example, that the United Kingdom couldn't do that. They have a completely socialized healthcare system. It could have been possible to do the same. Vietnam has a socialized healthcare system and it managed to succeed. So I don't particularly buy into this idea that there's something unique about the Vietnamese political system. It's just they were well organized.
2019. 29th of December, China alerts the World Health Organization to a new virus. 2020. 10th of January, Vietnam starts screening at airports and brings in a 14-day quarantine. They only have 3 laboratories. January 20th, 22 hospitals designated as COVID treatment centres. 25th of January, 2 COVID hotlines are established. Wuhan goes into lockdown in China. Vietnam has the first recognised case. Population ordered to wear masks. The Lancet, 24th of January. The Lancet reveals the acute danger to human life. 25th of January. Vietnam celebrates the Lunar Year. All schools and universities are shut. 30th of January. WHO declares a public health emergency of international concern. 1st of February. Land border with China closed. 7th of February, Vietnam successfully cultured and isolated the virus in labs. 15th of February, first recorded death from COVID in Europe. 23rd of February, a number of Vietnamese pop artists get together and create this song, I'm not going to pronounce the name, on washing your hands and goes viral, offering clear communication as to what to do to protect yourself from the virus. April, Vietnam now has 112 laboratories testing for COVID. 6th of March, there's a significant increase in cases totaling 200. 10th of March, who declares a global pandemic?
Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined.
18th of March, tracing every contact must be the backbone of the response in every country, says WHO. 21st of March, Vietnam suspended entry for foreigners from midnight. All Vietnamese citizens entering the country must go straight into a 14-day isolation. 31st of March, Vietnam goes into lockdown for 21 days. 21st of April, Vietnam ends lockdown. 15th of May, Vietnam has quarantined over 200,000 people at this point. 29th of May, domestic flights are able to resume. 25th of June, the first international flight between Vietnam and Japan takes place. 28th of July, the city of Da Nang goes into lockdown for 15 days. 11th of August, COVID hotspot app Blue Zone has been developed and rolled out across the country, allowing people to avoid areas with high levels of COVID. Within days, 20 million people have downloaded the app. By October 28th, Vietnam has not found any new cases of community transmission of COVID. By the 25th of November, the country has had 1,321 confirmed cases of COVID. 1,153 of those have recovered, resulting in 35 deaths. More than 1.3 million tests have been performed. So what do you think of the Vietnam timeline? What do you think of their reaction to all of this? And in the meantime, enjoy a little bit of music. Bye for now.
cho tay lên mắt mũi miệng phàn trên